Bismarck Insights with Mayor Mike Schmitz, a transparent and engaging conversational dive into meaningful topics impacting local government in Bismarck, North Dakota. Bismarck Insights is dedicated to removing barriers between the city of Bismarck and the citizens we serve every day.
Hello and welcome to Bismarck Insights. I'm Bismarck Mayor Mike Schmitz, and today I have with me Kurt Snyder of the Heartview Foundation. Kurt, thank you for joining me. We're going to share with our citizens a little bit about Heartview that maybe people don't know or they need to know more about. But first, let's get the audience familiar with who you are and what brought you from an educational standpoint and background to your role as Executive Director at Heartview Foundation.
Thank you. Thank you for having me. My journey is really tied to my own personal journey of recovery. And so I went through drug and alcohol treatment in 1993 and really had a new life out of that. And, you know, as the gratitude for coming out of something that was really destroying my life, I wanted to, you know, give back and help others to have a similar experience. So I went back to school and at the University of Mary got my license as an addiction counselor and a social worker. And so I started to work in the field as a counselor and got hired at Heartview. And when I did, I decided I wanted to pursue a little bit more along the administrative path. So I went back to school for a master's of management and became the executive director of Heartview in January of 2005.
You've been there almost 20 years.
Correct.
We're just around the corner as in this role, I should say, and longer than that in totality, I guess. So.
Correct.
So let's talk, you know, what is Heartview Foundation? What is the role of Heartview Foundation? What are the services you're able to provide and how do you implement?
Yeah, well, Heartview has a really wonderful history. You know, we just celebrated 60 years, established in 1964, originally in Mandan. During those years, we became a 91-bed inpatient facility, and we were kind of the only treatment program between Minneapolis and Washington State. And so during those years, we actually served someone from every state in the United States, every province of Canada. So really a cool, rich tradition. A lot of changes occurred. We lost the Canadian population. They started to serve them in Canada, and some insurance changes, and Heartview had to restructure. And so when I was hired in 2002, there were 8 of us in the office, and we did outpatient only. And what really I think was wonderful about that experience for Heartview is that we went away from a hospital-based inpatient model to one that was more community-based. And so over the years, we developed residential treatment, which the beds, instead of being a hospital, very sanitized kind of thing.
Yep.
It feels more like your bedroom, you know. So with residential services, we were able to really develop into much more of a community-based outpatient with residential. Today, we offer the state of North Dakota in totality 61 beds. 29 of them are in Bismarck, and a variety of services with over 185 employees.
That's an amazing story. I mean, I kind of remember the history and the transition, and for a while, I think it was a real struggle on how Heartview Foundation was able to move from the older model, more hospital or sanitary type, sanitized environment to what you're doing today. And what I see in that is that also makes those patients or those individuals who are going through recovery, which is a constant ongoing battle for the rest of their life, they're back into a home setting almost, so they know what it's going to feel like when they're moving to that next phase, and it's more comfortable.
Absolutely, and I think something else about it too is that when you have an inpatient model, that's what you use. Everybody goes into a bed, and imagine how disruptive, you know, not only is drugs and alcohol in your life, but to actually have to go to a bed for 35, 40 days. It's hard for families to, you know, accommodate someone being gone that long. And so I think that we've came to a place where we understand that the bed should not be the first choice, but the last choice. Because if people are working, if they're doing outpatient services, they can be in their home, they can still be working or going to school and contributing to, you know, their family and the community.
So you mentioned roughly how many beds there are across the state. That does drive the fact that most of your services are on an outpatient basis then, is that correct?
Absolutely. We have probably 650 active patients, but yet we have 61 beds. So without a doubt, more of our folks are in an outpatient setting.
And as time has evolved, it's a regional type situation or state. Are we still attracting individuals from outside of the state?
Occasionally, but not really. Most of our work is with the state of North Dakota. In 2002, we actually served 47 of the 53 counties. So we do pull from all over the state, but most of the people were from within the state of North Dakota.
And since you're based here in Bismarck and Mandan, but you're providing services across those other communities, those individuals aren't all coming to Bismarck.
Correct. We have a 16-bed residential program in Candu, North Dakota, and about a year and a half ago, we opened a 16-bed residential in Dickinson.
So you have counselors in those facilities. You have counselors elsewhere in the state that aren't at inpatient, so to speak?
No, most of our, we do have some from different communities, but they support us telehealth,
Okay.
and but most of our services are based in Bismarck, without
Okay.
doubt.
So how have you seen in your 20-some years in this role of helping people through recovery change? What's changed? Are we seeing a difference in the individuals, or a difference in the addiction, or a difference in the drug or the alcohol usage?
Yeah, I think that if you went way back, and you would see that, it was dominated by alcohol. And drugs had more prominence through the 80s and 90s. And what we see nowadays is people tend to come with a combination. Right? Very seldom is it just somebody that's struggling just with alcohol. But they also come with a lot of other complications, co-occurring medical, co-occurring mental health issues. So, people are complicated, and it's really, important. And, we see real value in meeting people where they are, and helping to, fit our services to their needs versus a 91-bed inpatient facility. It's sort of like that was the program. You had to fit to the program versus accommodating what people are coming through the door with.
Sure. So what are some of those services that we're providing that have evolved? Not me, I'm not providing them, but certainly you're a partner to our community, I guess. But how has the service delivery evolved? What are we having to do differently?
You bet. Well, we definitely have incorporated the use of science and evidence-based best practices. A lot of that includes use of medications, and also in terms of approaches and how we counseling techniques and theories that we use. So, it has evolved to where we can offer different levels of support based upon people's needs. So, of those 650 people that I talked about, some are in a bed 24/7. Mm-hmm. Some come 5 days a week, 6 days a week for, quite a bit of counseling, or even just very little individual work. And then there's people that'll come 3 days a week, 2 days a week, 1 day a week. So just really, and some people that will just do medications only, some people that will just do individual work, so they just come see a counselor only.
Sure. And so as this has evolved in time, and the struggles individuals have, opioid epidemic has been a big part of that environmental change, I suppose. How has that overdosing changed? How dramatic is it? And what is it that you're able to do to try to help those people?
Yeah, that's been an incredible thing to be a part of, and try to, been hard work. So 20 years of opioid epidemic, and you pointed out that I've been in my role about 20 years. So I have seen the evolution of that epidemic. And it started off with OxyContin. It was very much a healthcare overprescribing kind of situation, but that was the jet fuel to the addiction of so many people that were addicted, or that became addicted with sports-related injuries, so forth. It then changed into heroin because we quit overprescribing. The healthcare system understood and realized, and they really did a good job of correcting that. But the epidemic was on its way. So it turned into a heroin epidemic. And then, some years after that, it turned into a synthetic opioid. And more recently, it's fentanyl. And fentanyl is almost everywhere. It's the people that we're serving coming through the door, it's almost all fentanyl. And fentanyl, if you watch the news talk about it, it is so much more powerful than just normal opioids, sometimes 50 times more powerful.
So more addictive, more dangerous.
Absolutely. Tolerance. The tolerance increase is incredible. People are more impacted in their lives. And we're coming off of the epidemic of COVID, which was also, just such an isolating circumstance for people, which really, again, fueled the opioid epidemic. So then more recently, with all things fentanyl, it has really changed in a lot of ways how we're serving those people. We use 3 medications. The medications are Vivitrol, buprenorphine, and methadone. And prior to fentanyl, buprenorphine was really kind of the tool of choice. With fentanyl, it has really transitioned to where many people need the real structure and support that the methadone or the opiate treatment program offers, which is, it's complicated, but really methadone people get, they come every day for medication. It just is the support we can wrap around people is so much more important. And the mechanism of the medication is more effective with the fentanyl as well.
Are those individuals who are having to use that support system of the medication, are they able to ultimately get off of that once they get through the support processes and I guess, I don't know, change the habits or whatever it might be, or get the support at home?
Absolutely. There's people that do medications for a long period of time. It is a decision between the physician and the patient. However, many people, as they put their life together and the medication is just a small part, instead they're going to work and they have a family life and their life becomes full. The medication becomes less and less important, and that's when we will really work with people to titrate off. And so yes, the answer is many people do transition off, but it is a longer-term process.
Yep. As you've been going through your career, and I guess my question has always been, I think sometimes we think of someone is just an abuser of whatever the narcotic is, whether it's a prescribed drug or it's alcohol or it's some other delivery of heroin or cocaine. But is there also probably a significant underlying health issue that might be driving some of that, mental health, or what have you seen?
Yeah, I think that is drug addiction can stand alone. Chronic illnesses beget other chronic illnesses, right? I mean, sometimes if diabetes and IV drug use gets other kinds of illnesses as well. So there definitely are sometimes where people have a underlying mental health issue that drives their choice of what they use and the addiction itself. And sometimes maybe somebody has a depression where they excessively use alcohol. But I do think it's important to understand that the drug and alcohol use does stand alone on its own. I think a way to describe it is kind of the hijacked brain, because it's really hard to understand. When you watch these individuals pulling the roof down on top of their lives and they have families and maybe their children are thinking, gosh, Dad thinks alcohol is more important than I do, than I am. And it's not true. The hijacked brain is really that their need for the use of the drug or alcohol is much like their need to breathe. It's like, I can't not use. And so, they choose the drugs and alcohol, and the people on the outside are going, that makes no sense whatsoever. It is so mysterious how that plays out. But once you can help them arrest the the use and start to enter into recovery, they then can reprioritize again what's really important in their life. And if you were to ask them what's important, they wouldn't tell you the drugs and alcohol that are the most important. They'd say their family.
Yep,
And they
I
need
mean,
it.
and I know a lot of individuals who struggle with addiction, and when they're not using, or even when they're using at times. Like, family is hugely important, and they'll tell you that. I've had those conversations one-on-one, but then the struggle comes.
Absolutely.
And it's an ongoing, lifelong battle, as I understand, but maybe I'm wrong.
Well, I've been in recovery for 31 years, and I have a lifestyle that I live that supports that. I have a faith life. I exercise. I try to eat right. I try to keep my life in order, and I apply some of the 12-step skills in my life. I wouldn't say it's a lifelong struggle, but it is. It's like having other chronic diseases. If you have diabetes, you have to change your lifestyle in order to live successfully with that disease. However, it can be. Some people find that recovery is very difficult, and so they do have multiple relapses, and it's very difficult for them to get their footing under them in recovery.
Okay. Well, maybe a better answer would have been it's a constant monitoring.
Absolutely. Yeah.
So what are the things that you have found, and I believe, the impact that Heartview is having on our community and our state and our nation, frankly, just the whole process, that your services help the community with?
Yeah, I am so blessed, and our team is so blessed with being able to see people reclaim their lives. And so when people come to us and, they enter through that door, they're broken. They have no spark in their eye and no hope in their heart. And that's a really hard place to be when you feel hopeless. And so some of our, along that process, and you see them reclaiming their lives, that's an incredible thing. So how is that impacting? I think that addiction is like a boulder in a pond, a rippling effect everywhere. People are going to the ER and high cost health care, and it affects our jails and homelessness in all kinds of ways, families, jobs. But also recovery is almost like that boulder in a pond too, where the ripple effects of positivity, where they can start to work again. They're contributing to their family and their community in new and different ways. So recovery really can change that. I think it's a workforce issue. I think that when people can claim some footing in recovery and they can rejoin the workforce, that's an important thing for us as a state.
And I thank you for bringing that up, because I do think it is. It is a group of individuals who were once probably able to work without significant struggles, and they had a decline or whatever it might be. And if we can help them re-enter as they go through recovery, that's a huge thing. And most of these people have significant talent that can help our community in many, many ways. They're usually very beautiful people. Yeah.
And it's amazing too to watch, because I think we tend to be all or nothing people. So when we find recovery and we go back to work, we're all in. We work hard. I think when people rejoin recovery, their lives change dramatically.
Yep. So you kind of touched on it, but what are some of the success stories that you have seen in your career at Heartview, and what Heartview's foundation can be proud of, I guess?
Gosh, that's a great question, and there's so many. I go through, every month I'm getting notes from people that talk about having years, and just recently a young lady painted a mural on our wall when she was, in her first year of recovery, and it was part of our, and this was, 10 years ago, and her son was 4 years old, and he was a young boy. I don't know exactly how old he was, but he was sitting on a chair watching her paint it, and he was anti-tattoo, but just recently he's told his mom, "I'm getting a tattoo. Would you resize that picture you painted on the wall?" That's what he wanted as a tattoo, because he really recognized that it was that picture that helped reclaim his mom for him in his life. I had one time a young man who I would see all the time come in, and he was just asking him, what are you doing? How's it going? And he's like, well, I'm so lucky to be here. I was so under the ground on PTO. I was lucky I didn't lose my job. About a year later, I'm visiting with him again, and he says, I'm so excited. You know, I get to take a vacation. I haven't had a vacation forever. And a couple years later, and this is one of the people that were on medications that have been with us for a while, and I saw him maybe a year or two later, and he looked really upset, and so it concerned me. And I'm like, hey, how's it going? What's going on? And he's like, oh, I'm kind of just, if I don't take vacation, I lose it. And so it was really, I don't think he ever remembered having those conversations with me, but they sure stood out to me.
Yep.
That here's somebody that was at the end of his job, going to lose it, and turning around to where, you know, he's in a position where he has to take his vacation, or
he loses it.
So.
Yeah. Which is sad but good at the same time, or vice versa. So how does Heartview go about funding itself?
Yeah.
And what are the opportunities out there for it?
Yeah, we are a 501c3 nonprofit. So we have, I kind of looked at it as three legs to the stool. One is that we are healthcare. We offer healthcare, behavioral healthcare, but we offer healthcare, and so there is a fee for our service that is reimbursed through health services. So insurance, and that works like for any other healthcare system. You have an out-of-pocket or a deductible or a copay. So that's one way. The second is through grant writing. We do a lot of grants, and we write a lot of grants that help us to bring our mission to life. So if there's gaps in services, we'll write grants that, you know, our rule of thumb is that it's going to meet a need that's unmet, and that it's sustainable, and that we can continue to keep it moving in the future. Sure. And then the third is through fundraising. We can raise money for unfunded issues, or a lot of times our fundraising is to help us with infrastructure as we need different or buildings or facilities or different things to help us meet our mission as well.
And how have you been able to partner with the city of Bismarck?
Yeah, the city of Bismarck's been a great partner over the years. And first of all, with law enforcement, with the police department, we see them as probably one of our greatest partners. Public health, and the city of Bismarck, with its task force meetings that they've had for years, has been very proactive about trying to address the issues that are going on within the city. We've had a lot of different grant opportunities that we've partnered on, and so it's been a great partnership. Right now, we have a partnership with the police department called the ED grant, and it really helps to move people that are overdosing from opiates and help them to transition from a hospital setting into the supportive setting that Heartview can offer.
That's great. Excuse me. So what are some of the, I'll call them challenges, that you are facing now and as we look to the future?
Yeah, I think sometimes our funding is like standing on ground that shifts all the time, and it's hard to do strategic planning when you can't count on funding, for example. We are very unique in healthcare in that 50% of our population is Medicaid expansion, 25% is Medicaid. So there's been, over the last sessions in state legislature, a lot of discussion around changing the rates or whether we keep Medicaid expansion. And that's not been the issue, but the rates have really been.
Yep.
Well, when you have 50% of your population and you change a rate, that really is a huge hit on a budget. Mm-hmm. So we've just really struggled to make sure that we can keep the supports in place to allow us to continue to bring that mission into the lives of the people that are reaching out for help.
Sure. So for citizens, what do they need to know? If they know someone who is struggling, they recognize it, what do they do to help either that person or themselves, it may be, to get into this process of being a treatment at Heartview? What do they do?
Yeah, absolutely. I think first of all, as a loved one, it's important to educate yourself and understand how you can help and where are the services. But I would point out right away at the very beginning, we have an open walk-in clinic to where Monday through Thursday from 7 to 11 in the morning, you can walk in at Heartview and get an assessment. So there's no appointments, wait times, no scheduling. You just walk in. And so that's, I think access has always been really a difficult thing where, you know, when that moment comes when your loved one has been struggling for years and they finally say, hey, I'm ready to get help, and you call and you get told, we can see you in 4 weeks. That's just unacceptable. Yeah. So I'm so excited that we have we can offer that service to the community where you can just come in Monday through Thursday without an appointment. The other thing I would say is that a lot of times family members have been trying to help their loved one for years. And a lot of times because they just don't know how to help, the things they're doing aren't helping. Yep. And the things they could do, they're not doing. And so really that educational piece is important. We do offer a free program called the Heart Program. You can find out the dates on our website, but it's every other week. And it's free, no registration required. You don't have to have a patient at Heartview. And so people can go to that program and understand really what they're dealing with the dynamics of substance use, and you know how they can help their loved one, and also how they can support them and their family members.
Sure. So let's do touch points. What's the website?
Yep, it's heartview.org, www.heartview.org.
Okay. And number two, where's your facility located? If they want to be able to take advantage of that free assessment.
You bet. That walk-in is at 101 East Broadway, so right downtown, 1st Street and Broadway. It's actually on the back side of the building. It's an alley side, so there's a ramp that you walk in to access the building, and that's where all the parking is as well, so you don't get a ticket for parking on the street. But it is it's 101 East Broadway is where that access is.
Perfect. Kurt, thank you for sharing a bit about Heartview today and how people can get some access.
Thank you for inviting me. Appreciate it.
Thank you for watching Bismarck Insights with Mayor Mike Schmitz. If you have specific topics or questions you'd like addressed in future episodes, email mschmitz@bismarcknd.gov or call the City of Bismarck at 701-355-1300. To learn more about the City of Bismarck, visit bismarcknd.gov or follow us on a variety of social media channels by searching BismarckND.gov. Bismarck Insights is a collaboration between Dakota Media Access and the City of Bismarck. You may find Bismarck Insights episodes on Government Access Channels 2 and 602, as well as on Roku, Apple TV, and Fire TV devices, on Radio Access 102.5 FM, and on demand at freetv.org.